Hey, I'm Dr. Dino Pappas with the Rosti Rehab Centers in Northwest Hills, Austin. I'm going to talk to you guys today about a condition called Degenerative Spondylolisthesis. Here's the good news. If you have this condition, it's not infectious, it's not contagious, and guess what? You are going to live. But there's a lot of misconceptions regarding the condition, and I like to clear some of those guys up. So what is the condition, degenerative spondylolisthesis? This is a condition where over time the joints on the posterior, that's the back part of the spine, namely these joints are called facet joints, where they receive a little bit too much load, a little bit too much force. And over time, a small subtle fracture occurs, hence the degenerative nature of this condition. Again, occurs over time. As that occurs, one level can lose a little bit of stability and slide or slip over the opposite level. This can create pain in the back. In some cases, the pain can radiate from the back into the buttocks, the hamstrings, down the legs, or into the front part of the thighs as well. This is not occurs with every single case of degenerative spondylolisthesis, but it is possible in occurring. Oftentimes, doctors will put up scary pictures of MRIs or X-rays, and sometimes patients can have this condition and have no clinical symptoms whatsoever, and that's important because we need to differentiate those ones out from the patients that do have symptoms that often come to our office. So again, sometimes these patients no symptoms whatsoever, we just find it because we took a picture, an X-ray or MRI. Sometimes these are clinically relevant. And the first question you have if you see these are these stable? Is one level going to slide even further on an opposite level? The research says that stability of these, about 90-95% of the time that these are stable. There's no additional slippage that occurs. So that's the good news. The ones that do have a little bit more instability are typically subject to a little bit more symptoms, especially symptoms going down into the legs, sensation-wise, or I can't stand as much, walk as much, move as much, or they lose strength or they lose reflex. Those ones are important to separate out, and that's kind of what we do at the office. Which ones are clinically relevant or which ones are harmless or irrelevant, not a part of the clinical picture. So let me show you a couple exercises. In most cases, these guys are extension intolerant. They don't like positions that require back extension or standing for long periods of time or walking, because those all load these posterior joints right through here. So let's show you a couple simple exercises. The first of which we like to say is a knees to chest, which just opens up or decompresses the back and reduces stress to those posterior joints. And that's this guy here, pulling your knees all the way up to your chest and repeating that over and over and over again to reduce the sensitivity of those joints in the back part of your spine. Okay. The second one is a modified yoga position. Again, this is flexion based, reducing force or stress to the area in a position of flexion. It's just a modified child's pose where they rock back on their heels, tuck their chin down in your chest, and then open up or decompress the spine in that position. Again, unloading these joints in the posterior part of the spine. Once you have that, again, unloading those joints, try to think about some simple core stability exercises that can activate the core and then again reduce some of the stress to those areas, but in a 90-degree position from a nice, comfortable, neutral spinal position. An exercise that I like is the wall bug, where we're pushing into the wall 20-30%, pushing down into the table, maintaining a good spine, and doing opposite leg touches one at a time. Getting good core activation from a nice neutral position here. Again, this is a real simple exercise that accomplishes the purpose of core stability. Again, trying to buffer forces that cause compressive force on those joints of the spine. There are other exercises that we utilize in the office, but that's the principle. Unload the area, get deep core activation in a good neutral position of the spine. If you have any questions, please let us know. We're here to help you. Again, I'm Dr. Dino Pappas with the Rosti Rehab Centers.